Many of us in this room, myself included, were led to holistic medicine through our own suffering or that of a loved one or a patient. After an exhaustive and unsuccessful trial of the conventional arsenal of drugs and surgery, we were confronted with the unsettling option of looking for answers beyond the bounds of our medical training. In my case, the unconventional wasn't all that foreign. I did my medical training at the Philadelphia College of Osteopathic Medicine. Osteopathy was founded by an MD, Andrew Taylor Still, who had lost 3 of his own children to meningitis. The pain of his loss provided him with the impetus to expand the limits of the medical science that was being practiced in the late 19th century. It was never his intent to start a new school of medicine, but simply to improve upon the art and science of the healing that was being practiced by his colleagues. He began teaching a holistic philosophy that I learned as a first-year medical student in 1968. Called The Totality of Man, we were taught that when you evaluate a new patient, you must consider their mental, emotional, social, and spiritual status to help determine the cause of their illness. At the time, I thought to myself, what's the big deal? Isn't that just common sense? Wouldn't any good doctor practice that way? The problem was that although holism was the fundamental philosophical basis of osteopathic medicine, we were never adequately taught how to address the whole person. Nor was the concept of spiritual health ever explained. Unfortunately, nearly the entire 4-year curriculum was spent attempting to meet the standards set by our allopathic brethren in the basic sciences and in the diagnosis and treatment of disease. I'd gone to med school with my heart set on becoming a GP. In the late 1960s, nearly 75% of the DO graduates were becoming GPs, as contrasted by only 2% of the MD students. By the time I was ready to graduate in '72, family practice had just become medicine's newest specialty. I was thrilled. So I came to Denver and began a residency here at Mercy Medical Center. And once again, the message of holism was heralded loud and clear. The family practice textbook by Rakel and Cohn was replete with references to caring for the whole person. Here's a quote from the second edition. The development of the field of family practice has been directed to the whole patient, providing continuing and comprehensive care. Care includes disease prevention, health maintenance, and health education for those who are in health, as well as therapy to cure those in disease. The care of the family involves attention to all the factors that affect health: physiological, pathological, neurological, psychological, emotional, and social. The only missing component was spiritual. But in fact, as residents, we learned almost nothing about disease prevention and health maintenance. And what about health enhancement? And so once again, I was told to care for the whole person. But once again, I was left frustrated in not being given the tools to do so. Unfortunately, now there was an additional challenge. Not only did we not receive the training, but a busy family practice did not allow you the time to treat much more than the patient's chief complaint. I began my solo practice with excellent preparation for diagnosing and treating acute physical problems, minimal training for dealing with mental and emotional conditions, a strong intuitive sense about the role of the social component, and not a clue about what was meant by spiritual health. Did that mean you were religious?